The Learning Hack, a podcast about the people and technologies that are creating the future of learning. I'm John Helmer.
Now guess what? Learning is cool. Learning is cool. Learning is
cool. We've heard before on the Learning Hack podcast from Reda Sadki, who's president of the Geneva Learning Foundation, and does innovative work on learning in public health. With the global pandemic raging, now seemed like the ideal time to talk to him again. We're in crisis, but Reda, in a sense, operates within a context of perpetual crisis. He's worked on AIDS, Ebola, and more recently on vaccination programs, which was the focus of the last conversation we had with him on this podcast. So surely he's the person we need to hear from now. In this conversation we cover his new initiative, Teach to Reach, the difficulty of working on programs that require international cooperation when the tide of geopolitics seems to be heading very much in the opposite direction, and where we are with the current efforts to take pretty much all our learning and social activities online.
Firstly, Reda, for the benefit of people who are new to the Impact Accelerator program and people who might have missed your previous appearance on the Learning Hack podcast, can you briefly explain how it works and the results it's shown so far on improving rates of immunization in the countries where it's been tried?
Sure. So the sort of old bugbear of learning and development has been transfer, applicability, how people take learning and actually do something with it. So with the immunization work we've been doing with the World Health Organization and others, we decided to offer a sequence in which a pattern in which people could take the project that they have developed in the course, connect with other people in their countries, and actually work together on implementing those projects. And we're convinced that and generated some evidence to demonstrate that working in this connected way, both with people within countries and then connected across countries, could significantly accelerate how quickly people could move from ideas to knowledge to implementation, and could dramatically improve the quality and the outcomes of such attempts at improving immunization services and to reach the 20 million children that are not being that are still at risk from vaccine-preventable diseases. So, this is in 55 countries with hundreds of people, and the idea is to scale it up very quickly. There's no part of the system that cannot scale. So it's really, we first wanted to do the proof of concept that was achieved in January, and we then started to forge ahead with the next stage. And well, then COVID happened.
Yeah. And there is a pledge at the beginning of the scheme, and that's quite an important and unusual feature of it, I think. Can you talk about that?
Sure. So there's actually been in education, not so much L&D, but in education, there's been a lot about like the morality of education, the ethics of education. And I think that dimension, somehow the move to technology has been perceived as sort of undermining or reducing that dimension, if it exists at all. And we actually think that the experience of being connected, having that global connection. I'm a district health officer working in Zambia, in a district in Zambia, and through the Impact Accelerator, through the immunization program, I'm connected to hundreds of people from all over the world, and we share that commitment, we share that purpose. So what we did with the pledge was we actually wrote it down on paper or on a screen, and had that as a condition for participation. So we actually said most sort of digital initiatives are all about, we open the doors and please come, and would you please come and join and participate and comment and like and so on. And we took the other way. We said, this is not for everybody. We actually only want you to join if you're ready to make a moral commitment, not only to bring your technical expertise, but to put your heart and your soul into it. And of course, in learning and development, sort of how we get people to engage, I think is a very reductive way of describing what we're talking about. And it feels like, at least in this context, thinking in terms of that moral commitment is actually more powerfully speaks to the needs, and has led hundreds of people to take voluntary action in 55 countries.
Okay, so you've done stacks of work on immunization and pandemics, and we're now facing a very large, scary global pandemic with COVID-19, which has changed everybody's lives. As far as immunization goes, we're not there yet. There's no vaccine yet for COVID. But what can you say about lessons learned from the AIDS pandemic and Ebola, both of which you've had involvement with, and how those lessons were learned that would apply to what health professionals are facing right now?
So if you take the Ebola crisis response, there were literally thousands of lessons learned exercises. Every organization ran one. There were major, scientific publications that sort of synthesized and did the meta-analyses of all the lessons learned from the 2014-2015 Ebola crisis in the 3 affected countries. There's stuff ongoing now with the Ebola virus disease response in DRC, for example. Strangely, so far, I've spoken in the last couple of days with several people who feel that those lessons are being ignored. And there's actually another dimension, which is that, in fact, people in countries outside of Europe and North America, in some countries, have significant experience in epidemic response. The countries that were first hit after China do not. And to my knowledge, there's been very little, if anything, to learn from those experiences. In practice. And that's actually one of the things we are hoping to do in the coming weeks, is to bring together the people, the practitioners and managers from, who have that Ebola virus disease response experience, and to connect the dots between what is happening now. But what's amazing is in countries like Uganda, Rwanda, and a few others that shared borders with countries that are being hard hit by Ebola, a lot of the practices are already in place. Understanding what prevention measures look like, from hand washing to PPE, is already well ingrained for basically most of the health workers in the country. Have already gone through that process in a way similar, but with fewer resources than, say, the folks in Hong Kong or people who faced the SARS epidemic. Beyond like the big headline-making epidemics, these are also countries that are facing outbreaks of measles, that are fighting to eradicate polio. And again, there are people in the countries that have tremendous experience in actually how you build an effective response. And I don't feel like their learning and knowledge and experience and practice and expertise is actually being tapped at the moment. And that's sad, but that's something where we feel like the kind of learning platform, the kind of network system, call it what you want, that people have trusted us, trust that we had to earn, we're hoping that can actually change that to some extent.
On that subject, really, there are 2 narratives that I hear about COVID in the developing world, which is a bit behind the kind of Western European countries in terms of rates of infection and deaths and so on. And one of those is, well, as you say, there have been a lot of pandemics. There's been a big concerted response to that. So in a way, they're in a better condition to combat it than European countries, which have been kind of caught on their back foot. The other narrative, of course, that you also hear is, well, you think this was bad in the developed world, wait till it gets in the developing world where there's less access to healthcare and so on like that, and it's absolutely going to lay waste. I don't really know which of those 2 narratives to listen to. Where would you stand on that? You know more about it than most people.
We're going to have to learn that empirically. I think 2 things I can say is, one, and that's a harsh thing to say, but one is a lot is going to depend on the digital infrastructure and how well it holds up in in countries that are now, with the global spread of the coronavirus, and then, on the willingness to actually consider and recognize the significance of that local experience in countries that people have responding to epidemic outbreaks, and the sort of the value that's given to that, and the willingness of the global community to listen and learn from those experiences, which is why, again, I think that learning component is pretty systematically underestimated. So in the Lancet, writing in, I think it was in early 2015, Anna Patrick described that building treatment centers is obviously a significant challenge, but she actually claimed that one of the takeaways was that it's actually less difficult, less complex to build a treatment center for Ebola than to actually manage the human coordination aspect of the crisis response, which means the learning. And when you look at where the investment is being made, again, learning is like the poor little sister, the sort of neglected little sister. There are, I think 7 vaccine factories being built in case one of the candidates, so that production is ready to go if one of the candidates turns out to be effective, just so that no time is lost to build that, to go to production. Conversely, when we look at the investments so far that the global partners have made or are willing to make in the kinds of things that will actually strengthen digital infrastructure, I haven't seen a single project that aims to do that. And yet people that we work with are reporting that one of the challenges is that they're increasingly finding it difficult to access the internet. There's never been so much global circulation of knowledge, but there's a chance that it may never have been so unequal because of the crisis. And then the other aspect is just, there's a real risk, and it's something that really scared me about the threat of violence to health workers on a scale that could be as unprecedented as the pandemic itself. And right now there are signals that you kind of have to decrypt to figure out. And that's the ultimate learning problem, because that's about engaging with the communities. That's about the circulation of knowledge and what, sort of how fake news, the extent to which it's a problem of education. So those are the kinds of things we're wrestling with as we try to divert our main program called Teach to Reach to the COVID-19 response.
Learning is always a tricky word to pin down because it has so many meanings and it means differently in different contexts. The type of learning you're talking about here is very much on a kind of organization, country level, institutional level, on a communal level. I think joining the dots between that and, say, the organizational L&D community, which is the normal constituency, if you like, for the Learning Hack podcast, is it completely disjunct? Because I think we tend to think of learning in that context, the organizational context, as being an individual thing. Now, what you're talking about is, can a country learn? Can globally, can we learn from bad mistakes of things in the past and good things that happened? And on a more tactical level, can we learn and apply stuff that works in one place and then do it in another, which is what the Scholar program is about, as far as I see it. Does that feel right to you? Are we really talking about the same thing fundamentally? I think I'm asking.
If you think about why corporate learning and development focus primarily on developing staff, right? In many cases, it's like a staff development unit or team. There's a rationale, of course, for the performance of the organization. But I think, and so let's say the customer education was really the job of the marketing team, to some extent. They probably did not see their job as, being a L&D function, but, and I think any learning and development manager working from that perspective today is, unlikely to demonstrate value for their organization, because we live in a hyper-connected world. And if as an organization, for example, as a L&D manager, you're asking yourself, what is your role? What what can you do in a crisis like this one? If your job is reduced to people asking you to help them set up a Zoom webinar or how to do their classroom training in a digital format, I think you are underestimating the potential of learning and development, the potential of and the potential role that you can have for your organization. And that's a perspective we took with respect to our work on immunization. In a way, we were initially asked, can you just do a training? And yes, the newness of it was that it was going to be done digital. Now, this was way before COVID, and we're a purely digital outfit. But once we did that, we realized that there was a lot that was gained from people making connections, being connected to each other. And there's a huge amount of work, there's George Siemens, theory of connectivism. There's, there's the work around communities of practice. I mean, for about 30 years, people in learning and development have been trying to figure out what to do, what that means for our roles, what that means for what we can actually provide to organizations. So I think, we're looking at, in the same way as with one of our board members who's worked for decades on learning culture, who's also a guest on your podcast. Her work has moved from looking at learning culture and performance within the context of an organization to learning and culture and performance across networks. And I just think if you're not looking at the networks, and if you're not at least exploring that, trying things, you're unlikely, in the face of something as complex and as big a threat as this coronavirus, this COVID-19 pandemic is, you're unlikely to, be more than, basically the tech guy or gal who, shows people how to push the buttons in Zoom.
Yeah. So talking of Zoom, which we're using now, you do a lot of online events and very successfully, and you're pushing the boundaries of what you can do with those. Some of us may be experiencing Zoom fatigue right now. My last guest, Steve Deneen, said he's now spending 12 hours a day on Zoom, which seems a bit too much. Yeah. But if it seems likely COVID is going to be making live events difficult to stage for some time to come now, what learnings do you have to share with people who are having to replicate live events online and don't want to compromise too much on quality and impact? I think there's a presumption that it means lower quality.
I think that presumption about lower quality is significant. It's like the perception of loss and the difficulty for humans to adapt to change. I think is really what's being expressed there. So we do. Every week, Monday we have, this coming Monday we have 3 events, each of which will have, hundreds up to 1,000 participants each, and and right now we are using a format in which we've moved from sort of people making presentations to live dialogue and free-flowing discussion, actually organized more like a radio show, than a seminar or a lecture presentation with a Q&A at the end. Yeah. And what we found about those events is to think of them not in terms of if you need to have your business meetings or your work meetings with your team, that's one thing. But if you are interested if you see learning as a tool for change, as something that can help people, as the set of processes or the methods and the tools and the platforms that can actually help people lead change, then we really have to be looking beyond the webinar format. I think the fatigue reveals something that I'm really fearing, which is a backlash against digital transformation, especially if deconfinement, to put it crudely, happens soon enough that people will sort of retain the lingering bad taste in their mouth of being stuck in Zoom meetings all day. Where basically
it will have bad associations psychologically, you mean, yeah? Yes.
Yeah. And we'll be even more reluctant. We'll say, okay, we tried online, it didn't work. It was really unpleasant. And there's another dynamic which I see, which is that, like in our meeting on Monday, we had many people from many different countries who reported that they had already set up their digital networks. they're using WhatsApp essentially, because WhatsApp, you don't pay for the bandwidth in many countries. And it's the only part of your phone, it's the only app on your phone that has that feature. So, in a way, the digital transformation has already happened. So we're not there to teach people how to use digital tools for their own purposes, to serve their own needs and to, drive business results and be able to maintain continuity. And I think that escapes, like, especially the learning technologists focused on convincing people to adopt learning technologies. Well, wake up! People did not need any special assistance. Yes, for someone to say, "Let's jump on Zoom and do it." But I think the real value is going to come from elsewhere, and that's what we're trying to drive in our context. We're saying, with the next level of teach-to-reach certification, we have over 1,000 people who've finished the level 1 certification, and most of them are involved in the COVID-19 response, even though they're ostensibly immunization staff, and in all cases they're being affected by COVID-19, and many of them are trying to do things remotely. So we're trying to figure out, where is our advice useful, because they're doing it already, and how can we influence and help, sort of bring our experience, make it useful for people, so they can do better, go faster, and survive, and ultimately produce better results. But it's more about leadership than it is about technology.
I've worked with a lot of companies in learning technologies, but there are none I would recommend as wholeheartedly as Learning Pool. They have some of the most leading-edge, award-winning tech around, but also an approachable, honest style that means they're equally at home helping people take their first steps in digital learning. They're great with organisations small and large. They do platform, content, authoring, analytics and more, and have a 98% customer satisfaction rating. So if you have a problem to solve or an opportunity you need a can-do partner to help you make the most of, go to learningpool.com.
Is it getting more challenging now to work on the sort of supranational programs you've created, which happen, with a lot of countries, 30 countries at a time, you might say, in an age when walls are going up between states, quite literally in some cases, and the trend towards more international cooperation that we've seen in the second half of the 20th century seems to have gone into reverse? Is it getting tougher for the type of program you're talking about?
That's a good question. We haven't seen that yet, but I'm not sure whether we would, because what we've done is, in a way, short-circuited all the sort of hierarchical pyramids that exist, and connected directly with people who are, already the majority and the growing proportion of participants in our programs are people working at the district level or the health facility level. So really at the local level. Okay. And so their interest and willingness to connect with others from other countries who are working, the nurse in a health center in Kenya, and her interest in what she gains by talking to the nurse who was in India, or to the doctor in Bangladesh, who is working in his health facility. That doesn't necessarily change. And in a way, I believe that the more connections such as those people are making, the less likely it is that they will be okay with being, with the walls going up. I think that's part of the bet that we're making and that we're hoping in a small way to contribute to.
Does the defunding of the WHO by the US and a lot of the negative news stories we've seen about it, has that affected you, or does it not kind of trickle down to that level, or has those effects not been felt yet?
Not yet. Well, not yet. And it's a bit hard to distinguish between, the sort of the political, chess games between the, sort of 21st century great powers, the reality of the threat to global public health, and sort of the sort of international mechanisms for financing global public health and their frailties. That's not new. Those are not new. Those frailties are not new. Mm-hmm. I would see, again, a great role for education, for learning, education and training, in that respect. I think there's a perceived neutrality, about what about teaching and learning that makes it that I think is currently being underutilized. Again, that massive investment in factories, to my mind, should be alongside that massive investment in building the factories. There needs to be an equally massive effort in learning and education and training in a broad sense, in the sense of engaging with the communities. I just listened to a narrative from Ghana, in which the polio eradication team entered a community and was run out of the community with violent threats. Why? Because the community believed that they were coming to infect community members with COVID-19, with the coronavirus. And so that, my greatest fear is, we're a tiny organization working with, the big global partners, and connecting thousands of people, but still it's marginal. And the level of investment that's being made in education, and the kind of education, not sitting 20 people in a room, whether that's a Zoom room or a physical room at a time, to share information with them, but actually, empowering people through networks, through being connected to each other in new ways, and allowing them to experience that and make sense of it for themselves and see what they can do, how they can use that to make things better. I think I think that's scarier than, I think it's the sort of where resources are being allocated. That's one of the big issues.
All right. So from your perspective, with considerable experience in pandemics, how do you envisage the future panning out with regards to getting COVID under control? And what role can learning play in that?
So what we're betting on is that in a situation where there are nobody knows how to do this. There's no instruction manual. I don't have any experience in pandemic other than the experience of the what people referred to the HIV/AIDS as a pandemic, but that was let's say of a more focused nature, with some communities being much more affected than others. So that universality, I think, is something new, and it can be it's being challenged by the borders going up, but it's still there. And the role for learning, what we're exploring is we're betting that we're building what we're calling the idea engine. So it's going to be part of the Impact Accelerator and the Scholar package of interventions. And the idea engine, we've partnered with a British startup called Wazoku, and they have this platform that's used by large companies for internal innovation and idea generation. And basically, we're going to take that platform and take it to the folks we work with, and ask them to share their practices. And there's a funny thing, the whole thing about innovation as a form of learning is all about people.
Sorry, you've gone on mute.
So the whole thing about innovation is recognizably a form of learning. But the thing about innovation is often it's about the big idea. So, for example, the Gates Foundation runs what it calls its grand challenges. Can you come up with an incredible game-changing idea that will solve COVID? And we're actually going to be at the other end of the scale, which is about what Karen Watkins calls the little R&D, the sort of micro research and development, not micro learning, but yes.
No, very different thing.
And that's about, so what we find about immunization practitioners is that the people who are actually, reaching children and talking to the caregivers and doing it in such a way that the children leave, being protected from vaccine preventable diseases. My observation is that they tend to be very modest, very diligent, very constant in their effort. And I think we're underestimating the creativity and the everyday problem solving that they're doing in the face of COVID now, which is the main problem that's being reported is that caregivers are scared. So the health workers are still there, still going to make themselves available to vaccinate, vaccinate children, but the caregivers are too scared to come. And I'm sure that there are, people finding local solutions. But even if we said, do you have a solution? They probably say no. But actually, they're finding through their practice ways to make change and keep the keep the immunization services going. And it's actually, there's one of the recent studies shared by the Gavi, the Vaccine Alliance, has communicated on, is about showing that basically, if you shut down immunization services under confinement, for every one person who will die of COVID, you will have 100 people dying due to lack of vaccination and protection from other, from vaccine preventable diseases. So there's clearly something at stake in terms of maintaining continuity. It's the same thing in the Ebola crisis response. More people died of malaria, tuberculosis, and HIV than of Ebola itself, because of the interruptions in services. So we're betting on that local creativity. And what we do, if you're that nurse in a health facility in Kenya and you found something, you've been able to negotiate with caregivers, you've been able to get protective equipment for yourself and for your colleagues, and you've been able to organize vaccination in a way that is learning and leadership at its best. And the reason what we're setting up with the Idea Engine is a platform that will enable people to contribute those ideas, those practices, both the practices, things they're already doing, and people who say, hey, I have an idea, could we try this? And then the key piece is, one, sharing that back with a network. So someone who's looking for solutions can actually tap into the engine and find that, and sharing that with the global partners that are developing the guidelines, the guidance, and the global knowledge, the best that science can put together and the best that science can say in the face of all these unknowns. And we're hoping that those ideas can then feed and inform what is being elaborated by the global community as well. So that was already built into what we're doing with the Impact Accelerator. We're just ramping it up because of the crisis, the urgency, and the need to go even faster.
So there's an awful lot wrapped up in what you've just said, but there's two things in sort of like 4 or 5 potential themes there I just want to pull out. One of them is, it sounds a bit to me like when you're talking about, as opposed to the kind of Gates Foundation, big ideas, magic bullet, let's put all our energies on solving this one big problem. What you're talking about there sounds a bit more like, perhaps it's not a great comparison, the world of sport, marginal gains, the cycling team that's been massively successful, won so many Tour de France. The coach there, Dave Brailsford, talks about marginal gains, which is every day you try and do the small things better and better, and they add up to, in the end, to a kind of massive improvement. Is that a kind of philosophical direction, do you think, that underpins the Scholar program?
I think so. I wouldn't oppose it to the grand, to the sort of big ideas and big bets.
Or maybe you need both. Yeah.
Yeah. I just think that right now it's kind of lopsided. I think, fortunately, I've seen governments recently making significant pledges. Of course, in that geopolitical sort of chessboard, but on making the big bets. And there's been remarkably fast progress in terms of the scientific research, in terms of what the industry is doing, and so on, in remarkable ways. But my perception, what really scared me, what I learned from the last global event we did, is that I heard people reporting the threat of violence, or the kind of subdued violence in the fears, the rumors, addressed targeting health workers, and fears around the virus and the vaccine. Ironically enough, and if you unpack that and think, so those big bets, like building the treatment centers, you cannot respond to the Ebola crisis without a treatment center, and that everybody gets. But I think where it's lopsided is in understanding that everyday problem solving, the nurse who figures out how to talk to the caregiver. It's another story of a guy who goes for a vaccination campaign, and the village, a religious figure in the village starts chanting and going into a trance, and she's very opposed to the vaccination team coming in. It turns out that the previous year, the team had not properly planned for responding to what are called AEFI, so basically adverse events that can happen when a kid gets vaccinated, and that had left, justifiably so, a bad memory, in the village that was being expressed by this religious leader. So it took hours, maybe days of dialogue, to overcome that and to demonstrate that the team had sort of upgraded its capabilities, and that any children that suffered from an adverse event during vaccination would be receiving specific support, and that they would be responsive, and that there would be follow-up, and that measures were being taken. And then the attitude changed, and the team was able to to protect the children from vaccine preventable diseases. If you think about that example, that's just one. It takes incredible, not just technical skills, but combination of sort of interdisciplinary, intervention, and leadership and courage as for a health worker to sort of engage in this way. And I think if we're not doing that and significantly ramping it up, and I think the right sort of banner to do it under would be the banner of education, the banner of, and of course, new ways of doing education and learning. And there is a lot going on in immunization around community demand, community engagement. But I think right now we're underestimating, because that learning lens is not being applied as often or as much as it should be, or what you can see through that lens needs to, the way I'm interpreting it is that there's a real risk that, we might see unprecedented levels of resistance, that could manifest in, as sort of the threat of violence or actual violence towards health workers. I'm kind of asking myself, I left that meeting feeling like we need to use the tools that we have to connect people, to foster, to foster learning between peers. I see that as one of the only ramparts, against, do we really want to wait until a health center is burnt down by community members that believe that health center is responsible for COVID, or that the vaccine is responsible for COVID? Do we really want to wait for that? And then there's something even scarier in this increasingly divided, hyper-connected world. Would we even hear about it? If health workers die in that context, as they have been in the Democratic Republic of the Congo during the Ebola crisis response, would there be more than maybe a press release by the whatever agency had people killed or hurt or attacked in such an event? So I think one of the ways, so that significant experience with epidemic response that exists in developing countries, and then conversely, like to what extent there are efforts to connect, say, the Italian and New York and French and British, doctors to share their experience. I think there is a lot going on there because of the strengths of international medical and public health networks. But that those connecting communities, I think, is what it's going to be about.
Yeah, another kind of theme in what you're saying there is this tension and interaction between centralized authority and devolving problem solving to the level at which people know what's going on the ground to local level. We've seen a significant amount of that in the UK response to the pandemic, and one hears of significant missteps over, the very many NHS bodies. Nobody's quite in charge of it, and people on the ground doing things. I mean, just recently, today on the news, there was a thing about a whole load of PPE equipment arriving from Turkey, which turned out to be faulty, and the doctors were complaining they'd been told by, NHS England or one of these bodies, trust in the central resources, trust in it, it will come. And they're saying, well, no, we're better off. We've got a local supplier we know and we can trust, and we know that stuff will turn out, because big governments are just as liable to mess things up as anybody else, really, in a situation like this where it's all about learning.
So in a few countries, I have a sense of how those dynamics are playing out between, depending on the form of government. So a country that has like that's like a federation with a lot of autonomy in the regions, things are playing out differently than the countries that have a strong central government. I don't feel, so that's, I don't, I think that what we have seen, what works best is, again, it doesn't have to be a dichotomy. So in one country, in Ghana, we through our interventions addressed individuals, and then through the Impact Accelerator prompted invited individuals, if they wish to, as alumni of the program, to connect to each other and to so sort of decide on what they wanted to do together. Some did not wait for us to prompt them to start joining together. And in fact, in Ghana, what happened is that the scholars, so the people who have been through, who have successfully been through our programs, began to convene meetings on COVID-19, and they did it, using digital technology that they had seen was effective, in the last 3 years in our programs that they participated in, and did it without really asking us. They invited Dr. Alain Blaise Tatsinku, who's been closely, supporting them, and in that meeting, for the first time, they managed to get 270 people from across the country to connected local health workers and to engage them on, about the COVID-19 response. And they did it with the full support of their Ministry of Health expanded program on immunization national manager. So there's those individual initiatives in countries that have a stronger health system. You do have room for individual leadership at the local level. And what you get by digital means, if you have 3 people in a district somewhere and they call a meeting, and as long as they have the right kind of support and leaders who are willing to take a little bit of risk on trying that digital approach, those people are connecting everyone across the country and doing it with the full support of their central government. So I think there's a way to reconcile those tensions in contexts like that. That we've seen to be effective. What we're trying to do now is, again, that's when the country already has a relatively strong health system, and what we're trying to do now is to figure out how to set up, and foster and encourage exchanges between country teams, so that the country teams that are strong, that have full support of the Central Ministry of Health, can talk to the countries where things are more complicated, and see if that can inspire action and collaboration, and then looking to the global partners who do work with countries, and in some cases have significant influence over the countries that are more, where things are more complicated, to actually sort of positively influence that. That right now is more of an ambition, but it's definitely part of what we're going to do in the redirect, the pivot we're making, to support people involved in the COVID-19 response. Lastly,
Talking about that pivot and what you're doing, what can we expect to see next from the Geneva Learning Foundation? What are you up to now?
Our flagship initiative this year is called Teach to Reach, and Teach to Reach is about improving immunization training. So what we found was actually a real thirst for improved ways to do training and learning from, in immunization. In the pivot and the redirect, what where before we would say, well, digital stuff is one option, yes, and now the level 2 of this program is actually going to be focused on how you set up effective remote learning and support systems for health workers. So that's going to be a big focus. And again, the way we are working, the systems we've built mean we can work in all countries at once without having to compromise on scale. So right now it's 15,000 people, it's 95 countries, but it could be more. It can significantly grow, which is why we're actually thinking of expanding beyond immunization and inviting basically anyone involved in the COVID-19 response to join and participate and contribute to the shared learning and community and action that the scholar that's coming out of the Impact Accelerator and that we hope will come out of the COVID-19 redirect. We're also looking for, beyond the sort of events which has which serves to really convene and inspire and give, bring people together, give people that sense of connectedness, but also has near zero pedagogical value and as a sort of data and information sharing tool. In a 60-minute session, we'll hear from 5 to 10 people at best, and the selection will be fairly random unless there's a lot of preparation to sort of find panelists, and then that reduces the attendees to passive consumers of what the panelists are willing to give them. So we feel a real need, and we have some ideas. The idea engine is one. The other one is to use that metaphor of conferences where you have a plenary session, you have workshops and sessions, and people can network, and you can have sponsors, and you can have booths. Those are, I think, we're kind of like at the skeuomorphism stage of digital meetings and events and learning.
I'll put a definition, folks. I'll put a definition of skeuomorphism in the show notes for this. Right. It's something I've come across quite a bit, but when I first hit that term, I thought, what? So there may be some people who don't know it too well. Yeah, you're right. I think that's a great way of putting it. We're at the skeuomorphism stage of taking live events online. Reda, thanks so much for that. I think you're in a really interesting place, interesting in its in both its good and bad meanings, that because of the way that the world is, what you're doing with leadership and learning and knowledge sharing seems too small a word for it, because what you've unpacked for us today is something that's very rich and has a lot of lessons for everybody involved in learning, I think, at organizational and institutional level. Thank you very much for taking the time to do this today.
Thank you as well, John. Thank you.
That's all on the Learning Hack podcast for this time. Thanks to Reda and to our sponsors, Learning Pool. The Learning Hack is completely independent and transparently funded by sponsorship. Please subscribe on your podcast platform of choice. And if you want to help other people find us as well, please give us a review and a 5-star rating. If you want to sponsor or give any feedback, you can contact me at John Helmer on Twitter, on LinkedIn, or through my website, johnhelmerconsulting.com. We changed the running order to get Reda in this time. The next time we really are going to be featuring Donald Clark on AI. He's in characteristically competitive mode, so I can guarantee this is a conversation you won't want to miss. Bye for now.
Now I finally get it.